Hey beautiful soul, if you are having high grade of baldness, grade 5, 6, 7 and you are looking for a hair transplant to cover it up, do you know that can this be covered? Do we have enough resources to cover it up? What role medicines are going to play? Are the results which you are watching on internet, are they really transplant results or something else? A lot of questions which might have come to your mind or which may not have come to your mind, we are going to discuss them all in this video. So watch this video till end, and if you haven't subscribed our channel till now, subscribe it and don't forget to press the bell icon. Okay, let's start.
Satya Hair Solutions,
where trust meets expertise.
See, when you scroll the internet, you are having high grade baldness, you come across these pictures where you see results. Grade 7, completely bald. This guy gets covered completely and wonderful transformation, and it is being sold everywhere. So you will see this in India, Turkey, different part of Europe, Australia, everywhere. These results are being flashed. You will see this coming from, surprisingly, those clinics which do only FUE and they sell it by different names. So how does this miracle happen? And is it possible? Let's try to understand the mathematics of this. A normal person has approximately 1 lakh hair. Out of that, 70% are present in the areas where you lose hair in grade 7. 30% are present in the donor area. So that means if we want to cover this up, we need approximately 70,000 hair. If we go by the rule that you need, 50% of the hair in that area will cover it up, even then you need 35,000 hair. You cannot take all of them from the back of your head. Even if you take all of them, you don't have that many. We have maybe around 30,000 hair, and sometimes even these are thinning. And not every patient has similar kind of donor. So even if we take out all of them by any technique, we don't get enough numbers. Suppose someone even takes out hair from the beard. In the best of the beards also, from this zone, we can take out around 2000, maximum 2000, 2200, not more than that. So where does this come from? And what are the mathematics and what is the logistic of FUT versus FUE? Let's try to understand that also. So we know that when we are cutting a strip, we get full access to that particular strip zone. When we are doing FUE, we can take 1 out of 3. That means if I'm getting 3000 grafts by doing FUT from a particular area, if I do only FUE from that region, I get only 1/3 of the hair, that is 1000. Now, FUT is a procedure which can be combined 1, 2 or 3 times. It can be done depending upon the elasticity, and we know about the safe donor zone. So if I am doing a surgery, 3 consecutive surgeries through FUT, these 3 strips are going to give me a decent number of grafts. You can see the comparison. While if I am doing all FUE, I get access to just 1/3 of the grafts, and that is a very small number as compared to this number. So then how do I manage? How do I get those numbers? You will see very high numbers. People commit 6,000, 7,000, 8,000, 10,000 grafts by FUE alone. If I am doing one FUE and repeating second FUE, do you know this fact that there is scarring? And this scarring leads to change of angles. And as you can see in the animation, these angles of the grafts, when they change, and FUE is a blind procedure, when we put a punch there, we actually might end up dissecting the graft and it may not come intact. So the yield is further reduced. While if I am doing FUT in an area where FUE has already been done, I still can watch the roots. I don't cut them because I am directly visualizing these roots under microscope. That is another difference which is very important. Now we know that we don't get that many numbers. So how does this magic miracle happen? As you can see in this animation, there is a miraculous drug which is filling it up. That is a DHT blocker, finasteride. Now let's see how this magic happens. I'm showing you a case of this patient who is around 42 years of age, high grade baldness, grade 6, 7. Apparently, there are no hair in the hairline zone. It is empty. Crown is empty, middle portion is empty, very fine, small miniaturized hair which are present. Now, no one is going to believe that hair can grow with medicine in this portion, in this hairline zone. So people think that these hair must be transplanted hair, and that is the trick. That is where you get tricked. We gave this patient 1 mg finasteride per day and see how miracle happened. Now, if someone sees the pre-pictures, he would say, oh, this guy needs around 7,000-8,000 grafts, maybe more. And now if you see this 1 mg finasteride, no transplant, but see the result, maybe you will say this guy needs maybe around 3,000, 3,500 grafts, and it will get covered. If you look at the hairline zone, almost a full hairline has come where there were no hair at all. And these softer hair are going to contribute to whatever transplant if we do in this portion to such a great extent. This medicine, finasteride, works on the coverage, it works on the density, even where there are no grafts planted. Even in those areas, this medicine can grow a lot of hair. You can get a carpet of black hair cover, which we can see happening in this patient with this medicine. And not only that, the medicine also works on the donor. Let's see another example. One more patient, he went to a clinic for transplantation where he was suggested 3,500, 4,000 grafts and 1 mg finasteride per day. Patient didn't go for transplant at that point, but just started the medicine. And see, in 4.5 months, a wonderful transformation. These hair which have grown in the crown portion, in the front portion, we could not have done this with transplant so dense. No way possible, man. No, not possible at all. So this is made possible through the miracle of medicine. Take a closer look at the donor area. It has grown so thick. Another example. So let me give you example of the magic of medicine on the transplanted hair. Now this patient we operated, around 4,000 grafts we did, and if you see 5 months result, the hair are not growing that well. They are very thin, and his own existing hair were also thinning out. We had given him just minoxidil, not finasteride. 10 months picture, no significant growth, still the transplanted hair are very thin and existing hair thinning. 10 months, I started 1.5 mg per week finasteride, not 1 mg per day, 1.5 mg per week. And within 3 months, you take a look at the complete transformation. What happened? And imagine what 1 mg per day finasteride would have done in this case. This was a good transplant, great transplant, but yes, the transplanted hair were not growing to their full potential. And effect which you get with this medicine is directly proportional to the dosage. Let me prove you this point again with another example which you just saw. This patient, we gave 1 mg, but he developed some side effect because of the medicine, and we reduced the dose to half. You can see the result is also reduced to half. Now, to a lot of patients, it has been told that you take this for 6 months or an year and then we will see, we'll stop or reduce. No, it is not possible. It won't happen. Very unlikely. It may happen, but very unlikely. And if you stop the medicine after 6 months, 1 year, these are the patients who are very happily giving testimonials sitting on sofas of some clinics at 12 months and 15, 16 months. Unfortunately, they are here at Satya to get them repaired because they followed their doctor's advice. So whether you stop the medicine or medicine stops working on you because of tolerance, either ways, you will be in trouble. And what is the correct dose and how do you manage these doses? What is the concept of tolerance? Let's understand this concept with another example. So this is Dr. Bernstein's side, which I'm showing you, and one of the biggest collection of cases he has where the medical treatment was given, no transplant. We have given the link in description, you can check that out. So if you scroll through this, you will find that all these patients, no transplant was done, and in some of these, it looks even more than transplant. This grade 7 you see, it's just amazing, wonderful. No one can achieve this with transplant. We just discussed the numbers. And take a look at the dosage which he is giving. So in many of these cases, you will find that the dosage had to be increased to 1.25, 1.67. And in some cases, these patients are put on dutasteride. Not in his study, but yes, these days. So many a times I see patients, because we receive a lot of repair cases, lots and lots of repair cases. And the common factor amongst them, whether they go to a clinic which is very cheap, or they go to Turkey, or they go to US, or they go to clinics which are pretty expensive, where celebrities get this done, but when the common denominator in all these transplant results is finasteride, you are not going to get what you are planning to get. No way. So dutasteride is an important medicine, by the way, and you can see the link in description. We have made a video on dutasteride, you can check that out. These days a lot of people are told that we are not giving you finasteride, but they put the patient on dutasteride. Again, this is sad. So you have be careful. And if you go to a clinic which is doing combination FUT and FUE, and you blindly believe, okay, because we know that FUE alone doesn't give that number, so let me trust someone who is doing FUT, FUE. Daily we see patients where they tell that they tell us that we got 5,500 grafts in a single day, single session, and they were put on finasteride straight away, and when the finasteride love story ends, they are gone, they are devastated. And those transplants which used to look good, the hairlines which used to look good, when you withdraw the medicine, you start noticing kilometers gap between the hairlines, and they look really ugly. And the patient paid extra money, for this, just because some actor, some cricketer, some singer was getting a transplant done at that place. So be aware of these marketing gimmicks. When the common denominator, you don't know up to what extent, whether it is 20% contribution coming through the medicine or 80% contribution coming through the medicine. When you are in that mad race of density, coverage, low hairlines, you will be cheated. You are bound to get cheated. You are bound to get tricked. But it is up to you. If you use this information, and maybe, this information might break some belief system of yours. It might shatter your dreams or fantasies about hairline or hair transplant. You might see me as a villain, but who cares? I'm there to tell you the truth. I'm there for you, so that this gap between unrealistic expectations and reality is bridged. Satya is truth. Satya stands for those values, and we are here always for you. We are here to guide you. I would like you to share this information with people, as many as possible, because this is our combined responsibility. Another important case where how we combine and how less is more. Satya's philosophy is less is more. So if you see this patient, you will find, anyone would say, okay, 4,000 grafts and maybe blah blah blah. Now if we see, this is the result we achieved in 4 months. It looks really good, covered, and we did just 1,800 grafts. So where the rest of these hair came from? They came from the medicine. We gave him lesser dose, but you see the improvement. So guys, be aware of this. This is really important, and if you don't understand these things, you will be in problem. So number one message which is important, that grade 7 cannot be covered through hair transplant alone. If someone is showing you so remember that there is something wrong. If you have watched that movie PK, So there they use a word called wrong number. So remember, this is wrong number if someone is showing you grade 7. Second, and that too just by FUE alone. Double alarm. Okay, so number 2 is FUE doesn't give you that many grafts, so these numbers are mostly trick numbers. Number 3, medicine is not just helping in sustaining existing hair, it is doing much more. So be aware of the medical problems associated with this, the side effects, dependence, tolerance, because it would be you who will be facing the consequences, and the clinics will just sell and move away. What happens to these patients after 2 years, 3 years, 4 years? Maybe they might show you 1 case, 2 case, 3 case, but what about the rest? They bite dust. So I hope you like the content of this video, and I would like you to share this, and if you haven't subscribed the channel, do subscribe it. And if you have questions, if you disagree with my point of view, I would love to know what's your point of view, so that we can have a healthy discussion over here. But again, the intent behind making these videos is to make the community aware who is getting these transplants done, who is looking for solutions, and as well as for the doctors. A lot of doctors also are not aware of these concepts, these facts, and they are under the illusion. Sometimes even doctors think that they have done some wonderful transplant, which is obviously not coming through their hands. So with this, I would like to conclude, and thank you so much for watching this video till end. Love you.